Please click the like and subscribe buttons so that you can receive more of MAP's clinical pearls and technique videos.
G'day, Chris Showalter, Program Director, MAPS, Maitland Australian Physiotherapy Seminars. We're going to take a look at a very useful technique in examination and treatment of the cervical spine called a unilateral AP. It often has an effect on anterolateral symptoms and neurodynamic symptoms like golfer's elbow, tennis elbow, carpal tunnel syndrome. The idea is to palpate the anterior tubercle of the articular pillars in the cervical spine, and to differentiate that which is hard and bony from the carotid artery, which is soft and pulsy. So hard and bony is where we want to be, soft and pulsy we want to leave alone. The way I approach this and the way that I describe this to the patient is I say, Michael, I need to take a look at how some gentle movements at the front of the neck affect your symptoms. I understand it's quite tender in there. I've had this done on me. But I want to make sure that you and I can differentiate between the tenderness of my palpation and the actual symptoms you've been reporting. Michael, I want to take a look at the front of your neck and I'm not going to choke you. And what that then does is I put my hand straight into the choke position. That allows me to rest my ulnar border on his upper sternum. That allows me to use a bridge to keep off his throat rather than being on his throat. I'm bridging. And that puts this thumb here right over the anterior pillar of C7. I can then come over the top. This thumb here is the dummy thumb. The other thumb comes in over the top. And with my body in the correct posture, I can gently evaluate C7, C6, C5, C4. Around C4, we need to go medial to sternocleidomastoid, C3, C2, C1, all the time keeping my hand off the front of his neck. I hope this little video has helped you to refine your AP techniques. They're very useful and often overlooked by some therapists. Hope you enjoy.
To learn more about MAP's 17 different remote learning and live course options, go to ozpt.com.